So someone asked the question, why is it I've had my hip operation 4 weeks ago, when I first get up it's really stiff? How do I get that moving? So I posted a few comments, but I thought I'd show you and explain to you why, because once we know the reasons why, it makes a lot of sense, doesn't it? So if you think, like, if you cut your finger and you can see a cut on your hand and you can see the crust, and you know sometimes that feels tight when you first move it, think about how that feels for your muscles. So 4 weeks, 90 days is a good turnover time for muscles. But 4 weeks is sometimes not long enough for the deep healing. So the scar tissue might have healed on the outside, but the deeper healing can take anywhere up to 6 months. What we have to think about is not only do we cut muscle, but we also cut fascia. So fascia binds the muscle together, and sometimes the fascia becomes knotted and tight. And the fascia acts a little bit like toffee, okay? So it's very challenging to move, and you need to warm it in order to let it move a little bit and let it release. Now the fascia runs through your body a bit like a Spider-Man suit, which is quite cool, isn't it? And it moves in like spirals, okay? So I love making breads. Anybody else like making bread? So when you're making bread and you knead the dough so that you can get that dough to be a little bit more elastic, you need to think about applying that same kind of thing to the fascia around the scar tissue. But listen, because it's a Spider-Man suit, you need to move your upper body as well, because if you think it's tight and pulling here, you have a corresponding pull somewhere else. So if you've had hip here, you might find pain in this area or even in this shoulder. So there's a couple of things that you can do. Number one, you can use friction. All right, so you can use the heel of your hand, rub the area, warm it up. So remember, you want it warm and you want it moving before you start to go. Because can you imagine that first step, that big step, that's when it's going to go, oh, okay? And when the body goes into that stretch and it doesn't like it, it sends a signal to contract the muscle, okay? Same thing happens when we overstretch. So you don't want to irritate that signal to begin with. Really helps for you to talk to your muscle and say, we're going to move now. All right, so the brain's already thinking, oh, okay, the hip's going to move. Let's think about this area. So you can warm it up like this. You can use your Pilates ball, which is absolutely fantastic. You can sit with the ball here, okay, on a chair. And what you want to do is to move your hips side to side and create pressure between the ball and your sacroiliac joint. That area has got a massive amount of fascia. And if you can roll your hips this way or that way, either on the floor if you're flexible enough, it doesn't have to be fully pumped up, okay? So it can be semi-inflated ball, and create pressure and then create movement, or even lie on the ball with your legs up into the air. That works really well. Move. All right, so you want to move here. Don't worry, it's not on the hip scar area. This whole thing, remember, works like a suit. You can also then start to work these leg muscles, okay, because these leg muscles are massive and they need a lot of blood. So remember, we've talked about this before. Most of your blood is here. We want to make sure that the blood is in the working muscles before we do the work. So before you get up, you can do a few leg extensions like this. This is not particularly working that hip joint, okay? It will a bit, but what it's doing is bringing blood into this big muscle here, which is going to help warm up that area. The other thing you can do is do that breath work that we were doing about, okay? Kick your leg, flex your foot a little bit, so you can't see that, so you can flex your foot a little bit, and then do that. The other thing you can think about is when you're in the standing, before you've moved anything, if you think of the compass points and this being east and west, find out where your hip joint is and push into your hip joint. Now this kind of rocking movement is lush on your body, okay, but also if you place your hands onto the top here, you'll see how the pelvis is moving. If you place your hands onto your lower back, you'll see how your lower back is moving as well. And I find this is an instinctive movement anyway for most humans who've got lower back pain, because it works. Okay, so when we're stretching and we're moving and we have an injury of some kind, we don't want to go straight away into static stretches. In fact, I suggest you move in and out of stretches all the time. Once you've done that a bit, you might pause a little bit and then come out. So you might do something like this, yeah, and then just kind of go, oh, a little bit of a stretch, or from here, a little bit of a stretch with your bum sticking out. Then when you want to move, remember your body is a system of levers, all right? It doesn't work in isolation. Just because you've got an injury here doesn't mean the rest of your body's not influenced. When we step and we walk, we want to do heel, knee, hip, back, yeah? So it's that sequence, heel, knee, hip, back. When we've got an injury, what can happen sometimes is we'll take small steps like this, all right? And that means we do not use the hip as well. I mean, what happens is we use ankle knee. So it kind of goes like this, ankle knee, ankle knee, ankle knee. So I know when somebody's got a bad back, because they'll walk in, ankle knee, ankle knee, ankle knee, and not move their hip. What you want to be doing is ankle knee, hip, and then spine. And when you're doing the spine, have the sensation that somebody's got their hand in your back here and that they're pushing you forward. So you kind of lean back into it and you can move that way. Don't forget your shoulders. Remember we said this corresponding pain on the diagonal. You want to release the shoulder on this side and you want to do things like stretch up. Now, if you can't lift your shoulder, tilt your body here, okay, to stretch the fascia, like pull in, yeah. Think about doing it slowly, yeah, small movements, bigger movements. And then you can think about maybe just a little bit of a twist, not too much. Remember, you don't twist the hips, you twist the upper body. So if you think of the fascia here, when we twist, we're stretching this side. When we twist, we're stretching that side. If you're moving your hips like that, we don't want to be doing that, okay? Your knees don't want to do this. So then when you're walking, you can do this. So you can do movements like this, taking the weight forwards and backwards, and practicing as if you are going to walk before you go anywhere. That preparation really helps to prepare the muscle and reduces the risk of any kind of, they call it injury, but it's not so much that. It's like about doing the preparation, you know, like you get in the car. These days, do you remember I'm old enough to remember you had to pull the choke out. Okay, so you want to think about doing this swing and sway, and you can do that, you're making your cup of tea in the morning, do a little bit of this movement through the hip. Think about ankle, knee, hip, spine, ankle, knee, hip, spine, stand up. The body learns by repeating, all right? So the more times you repeat, the better it will get. Enjoy, I hope it helps.